Starting it. Oh, sorry. Jack. Thanks everyone for joining us today. We'll just wait. I think the Zoom protocol, the etiquette is to wait a couple of minutes past the start time, and we're just hitting 7:30 now. So we'll wait to let a few more people join. I'm not sure, I'm not sure the numbers we're expecting, to be honest, but we'll wait. a little while. I'm expecting at least another person that I know of.
You know,
Yeah.
it's a weird time.
Yes, it's a weird time. Yep. But we do appreciate everybody tuning in.
Absolutely.
Yeah, I think we should expect a couple more people. Were you working today?
Mm-hmm.
Yeah. Yeah, it's a pretty rainy, gross day.
I know. It was like the weather couldn't decide what it wanted to do.
No, my son was out there in the rain between his classes picking dandelions.
Okay.
Yeah, my husband said he'd give him like $1 a bucket or something like that. One of
That's
those
hilarious.
big yellow buckets.
Oh, nice.
It's like pretty pandemic kind of related way to spend your day.
Definitely.
You're not your typical Wednesday activity for my child, but whatever works. Yeah, whatever works. All right. Well, I think I'm going to start. We are expecting a couple more people, but it's okay if they come in a little later. So yeah, welcome everyone. Welcome to our third webinar that we're doing monthly here at Choice Health Center. This is our third one. Our first one, you can find them on our website and also on YouTube, our YouTube channel. The first one was on laser therapy. The second one was on chiropractic care. And today we're going to be talking with Ryan Young, one of our massage therapists, on massage therapy here at Choice. So I'm just going to block out my my video. And we're going to be talking here today about massage therapy, as I said. So welcome and thank you for attending. We're excited to be here with you today to share our knowledge with you on massage therapy in general, and in particular, how massage therapy at Choice Health Center can address everything from pain to performance. So my name is Erin Kemp Sutherland. I'm a chiropractor and I own Choice Health Center with my partner, physiotherapist Saba Chisti. I've been practicing chiropractic for 17 years and I founded Choice Health Center 13 years ago. This was after I had practiced in many, many clinics throughout Ontario and Nova Scotia. Some of them were pretty sports medicine-like, but all of them were multidisciplinary. And over the years, I've been working alongside some fantastic massage therapists. So I realize and recognize that they're amazing in helping our patients receive the results that they need. So with me today, on that note, to help me present this information to you is one of our 5 massage therapists, Ryan Young. And Ryan, I'll just let you kind of introduce yourself and give a little background about yourself.
Certainly, I'll try to do it quickly so we can move along here. I've been practicing since 2006, born in Nova Scotia, born and raised down in the Annapolis Valley. And I went to university in Ontario and also did my massage training in Toronto and graduated there. And shortly thereafter moved back. None of the lakes or rivers really sufficed when it came to the need to have salt air. So moved back home. And similarly, been very fortunate to have been able to work alongside some fantastic practitioners in multidisciplinary settings, oftentimes focusing on very active and athletic populations. And I've also been incredibly fortunate in terms of my ability to travel for my professional development and learn from some fantastic people around North America and the world, really. And definitely excited to pass along the information and the insights to people who are looking to get a little bit.
Yikes. I don't know if this is showing up, guys, but I hope it's not. Yikes. How do I get that to go away?
Technology's fantastic when it works.
Yeah. Okay, I'm just going to stop sharing my screen for a minute, guys. I am just going to, I don't know if you were seeing that, but it was my email, not cool. And we are going to go right back. I'm going to just get right back in there. I just want to make sure that mail is done. There, I quit mail and I apologize for that. And I am going to begin. Just give me a minute. I'm just a little flustered by that. I am going to share my screen again. There we go. Oh gosh. Technical difficulties. Okay, I'm getting confused here. Okay. Okay, I am just gonna stop sharing again. Okay, and okay. No. I was weird. Now my mail's been acting really weird lately.
Okay.
Yeah. Yeah. And I was worried that was going to happen, and it did. Okay. So anyway, Ryan, I am so sorry that we interrupted you talking about yourself.
That is okay.
And I'm going to go back to screen sharing.
Yeah.
And here we go. Let's hope that this time my email doesn't kick in there. So yeah. So yes, Ryan,
okay.
A lot of experience.
Yeah. So I've been practicing for 15 years. I've been incredibly fortunate to have been able to surround myself with incredible people who've been very gracious about sharing their own education, insights, and practices. And I've just really been enjoying bringing that to the choice clinics and collaborating with everyone here.
Great.
And looking forward to kind of sharing a little bit about that in our presentation here tonight.
Great. Awesome. All right. So that's who we are. So who is Choice Health Center? Well, we are one of Atlantic Canada's largest privately owned multidisciplinary clinics. We offer chiropractic, physiotherapy, including pelvic floor physiotherapy, acupuncture, naturopathic medicine, massage therapy, and concussion management. We also have a clinically supervised personal training department. We have a kinesiologist and a podorthist, and we offer yoga, Pilates, and kin stretch classes, and a lot more. All right, so technology tonight is really my enemy. So anyway, our goals are your goals at Choice Health Center. I've always said that from the very beginning. Whether your goal is to be able to keep up with your grandchildren or to run a marathon, we work in a truly collaborative manner off of one chart together as a team with you. You're one of the most important team members, obviously, to get you to where you want to be. We want you to thrive, whatever that means to you. We're here to help you thrive. So education is knowledge, and knowledge is power, right? We've definitely all heard that before. So we feel that by reaching out to our community in this way through webinars like this, And when the pandemic ends, we'll get back to doing lots and lots of in-person seminars. I look forward to that. We are taking massive steps towards helping our community to thrive as we educate them in this way. So what makes us different at Choice Health Center? Well, we are actually so different that we have coined a phrase. It's called the choice difference. So there's a lot of clinics out there that are starting to offer the array of services that Choice Health Center offers. However, when we, many of these clinics, when we look at them, there's clinicians that are working under one roof, yes, but perhaps each are working in their own practices, in their own individual silos. And a given patient will only see one person at a time. So referrals will happen sometimes when someone doesn't respond to this type of silo or care, and or if the insurance money for this silo runs out, then the patient will maybe move on to the next silo under that same roof. So one silo at a time, and they're often passed from one to the next and not necessarily seeing the results they deserve. So at Choice, like I say, we are a multidisciplinary clinic with all of those services under one roof, but we work in a synergistic way. So synergy is the belief that the additive effect of two different things, in this case therapies, is actually greater than each component would be separately by themselves. So 1 + 1 is actually greater than 2. So an example of this would be, say, for example, a very common example would be chiropractic care when it's combined at the same time with something like, say, for purposes of today's webinar, massage therapy, the effect of the chiropractic care would be greater than just doing chiropractic care alone, and vice versa. So we have 2 locations. This is something that people find very convenient for us, where both of our locations are conveniently located with lots of free parking. Another reason why you might choose Choice Health Center is one of our core values is we strive to stay ahead of the curve. So yes, we offer advanced technologies, laser therapy, shockwave therapy, advanced wireless muscle stim, neurofunctional acupuncture, and we're always working to stay ahead of that curve that is very, very quickly moving in our industry. So today, without further ado, we're going to get into the meat and potatoes of our talk. And the agenda is that we will be talking to you about, first of all, what massage therapy is, and then connect that to how massage therapy treatments can impact your pain, and then follow that by how it is an effective means of facilitating improvements in your performance. And that's whatever performance means to you. And also how massage therapy can help along the outcomes of the treatments you receive with our other healthcare professionals. So how it works in an integrative manner to improve your overall response to care. So we'll address a few misconceptions as well about massage therapy, as well as what to expect from a massage therapy appointment at Choice. Oh, I almost forgot. Yes. We will do our best to keep this very, very engaging for you. And if you stay until the end, you will receive a really neat special offer from us. And hopefully that's not the only reason you stay, but if that's what it takes, we've got a great offer for your time tonight. So a couple housekeeping points before we begin. On your Zoom call, you'll have a chat button at the bottom of your screen. And if you have any questions, we would love to answer them. But in order to get through this material as quickly as possible, we will answer your questions at the end. But please do write them away in the chat as they come to you, and we'll get to them at the end. So here we go. Without further ado, I'm going to let Ryan kind of take over so that we can learn how massage therapy can help us from pain to performance the Choice way.
Perfect. Thanks very much, Erin.
No probs.
So our first slide, just generally speaking, a definition for massage therapy that comes comes from the Registered Massage Therapists College in Ontario. And these are the standards of practice that we follow here in Nova Scotia. Now, there's a lot of information about massage therapy out there, as it's a vast topic for discussion, all kinds of areas of specialization in the practice. But for the purposes of the webinar tonight, we're going to cut right to the chase of what it is that actually makes us feel so fantastic after a massage. In a nutshell, it has to do with how massage therapy impacts the circulatory system, the blood flow within the body. What a massage generally does is it helps to bring more blood flow that brings oxygen and nutrients to the tissues that haven't been getting it. And so they've been trying to operate, or they've been trying to carry out the tasks that we ask of them without having had enough resources or fuel. Some people experience their massage as a bit of a buzzing or tingling in the tissues after the treatment. I kind of joke with them. I'll often say, well, that's what circulation feels like. It's almost like the tissues and the cells are having a feeding frenzy, having all this oxygen and nutrients that they haven't been getting. Others are just going to simply describe a sense of reduced stress and strain throughout the areas that they receive treatment. But before we get into much of it, why do we start to hurt in the first place? This is a great quote from George Bernard Shaw that I like. We don't stop playing because we get old. We grow old because we stop playing. This is very much linked to a lot of people perceive this as a cliche, but the idea of use it or lose it. In order for our tissues to feel good, we actually have to keep moving often enough and in varied enough ways. Going back to the idea of healthy blood flow, our bodies need to be moving often enough and in enough varied ways in order to send and actually manually push with every contraction and relaxation of muscles. It pumps the circulation into all the areas that need it. But when we don't, those areas don't get what they need and they suffer. The joints that don't move enough begin to lack enough lubrication to allow them to continue moving. From here, things can begin to feel as though they're seizing up. I hear that a lot from patients. Or that things are just coming to a grinding halt, and people tend to get frustrated the longer this goes on. They're not quite sure how to reverse the trend for themselves. So how does massage therapy actually help with pain? Again, surprise, surprise, increased blood flow. The tissues aren't getting enough hydration, oxygen, and nutrients. And one of the ways the body lets us know that we're not getting enough resources in those areas is we actually start to feel achy and painful. The tissues will actually start to feel sluggish. We'll start to feel less energy. We also increase our perception of tension through those tissues, okay? One way I like to explain this to patients is you'll see in the bottom left of the slide here an image of a candy wrapper. Yeah, I spend a lot of time in a small, dimly lit room pondering these kinds of concepts, coming up with analogies. It's something my patients like to make fun of me for. But the candy wrapper, if you imagine the two ends of the candy wrapper as being two joints. So for example, let's say your hip on one end and your knee on the other. And the candy in the middle, or the wrapper in the middle, would be similar to the musculature or the muscles of your thigh. Now, if we tighten up the two ends by virtue of not moving a whole lot, as many of us are having to sit at home working in weird, awkward, unfamiliar positions, our joints tend to tighten up the more we don't use them. Again, use it or lose it. Mm-hmm. And as things tighten up through those joints, it actually pulls the middle taut. And as that happens, it reduces blood flow into those muscles. And we might, at the end of the day, feel like we have restless legs or achiness in the joints and through the tissues. It's because those tissues aren't getting what they need. And honestly, this is kind of a simple concept, but it really doesn't have to be more complicated than that. I don't know about you, Aaron, but I know in my experience, our industry has done a great job at times of kind of overcomplicating things for patients.
For sure,
yeah. And it really doesn't have to be so elusive. Mm-hmm. Okay. Now, the other thing in terms of redistributing tension. So with massage, what we're trying to do is we're trying to loosen up things around those joints so as to introduce slack back into the middle, which actually allows for better blood flow. And we have a couple images later on that'll help better show this. But some of the major changes that happen over time, is actually found in the connective tissue, or better known, often referred to as the fascia.
Okay.
Okay. So what is fascia and why it matters? So here are a couple images. Fascia is essentially connective tissue that encases every part of our tissues in the body. It simultaneously connects and separates everything. We have a great image on the top right here where it's the muscle fibers in the red are kind of teased up and almost looks like cotton candy or dew on the grass. So that is actually connective tissue. Now it has a really high tensile strength. So this transmits tension through the body. So when the joints get stiff, this stuff gets pulled taut and it restricts around the muscle fibers. We have pictures of oranges here because for those who aren't as familiar with meat, muscle tissue would be like the juicy pulp within the orange. The connective tissue or fascia would be like the membrane encasing each pocket of juice or pulp throughout the orange. Okay. Now the picture with the blue musculature throughout the body, this is just helpful when it comes to understanding how connective tissue might transmit force from one area of the body to another. So for example, we might have someone with a hip condition or pain through the hip, and we may end up talking about treating the opposite shoulder. Well, it's because the connective tissue transmits force from one shoulder to the opposite hip and vice versa. Okay. Yeah, and for the next one. So again, it's sort of like a saran wrap. This is another analogy that you'll hear oftentimes with different therapists. It encases every part of the muscle. So we've got the narrow part of the muscle fiber up here at the very top. That is encased in fascia. Then this bundle of those little guys, again, is encased in connective tissue. Every one of those is encased, and then the entire muscle is encased in it. Okay, so it's fairly extensive. It also actually encases every blood vessel and nerve. So we have blood vessels and nerves running throughout the muscle tissue that are also encased in this stuff and can get caught up when things aren't moving as much and start to get stuck.
As well as our bones, you say. Yeah.
Yeah, sorry.
That's
so,
okay.
Yeah, if you, no, absolutely. So if you
put
people who, again, eat meat and are familiar with pulling a bone out of a chicken or a turkey, the bone is often slippery. It's because it's encased in fascia. And so the next slide here, we have some images here that kind of help us. On the top left, we've got some fishnet, and this is meant to represent fascia. On the left, we've got a piece of fishnet that's fairly free of restrictions and knots. Whereas on the right, you can see where there are stuck areas that end up pulling into adjacent areas. And this is essentially what happens in our tissues oftentimes. Areas that don't move enough and don't receive enough oxygen and nutrients and hydration, they get kind of gummed up, but they'll pull into adjacent areas and they can create issues in adjacent areas away from where the primary restriction is. Okay.
That's kind of like that sweater analogy that we always use with, like, say, scar tissue after surgery.
Absolutely, and that's exactly what the image on the right is showing.
Right.
Where you can kind of see with the lines on the grid of the person here, where when you pinch and pull, it pulls into other areas.
Right. Yeah. So you're pulling here, but yeah, this is where the adhesion is.
100%.
It's affecting things here.
Definitely. And the image on the bottom left here is something I find really helpful to show people, keeping in mind that sweater analogy. Those fibers represent connective tissue, but you can see how the arteries, the blood vessels, and the nerves are kind of caught throughout.
Oh, yeah.
So if you pull on it, you can compress upon or pinch pain-sensitive structures. So that can actually, in some cases, be what's going on with people's pain and condition. And it's not until we kind of approach things and introduce some slack back into those painful spots that they start to feel better, as opposed to maybe just massaging or treating the area that hurts. Sometimes you have to be a little more strategic.
Right.
And work to introduce slack into the area. Okay.
Cool.
So that's a bit about the pain side of massage therapy and how we can help improve your situation. Then there's the performance side. I mentioned, having been so fortunate in my career to have been working alongside great people and learning from great people from all over the place. And performance has really come away from where it's traditionally viewed, and that's in the sports arena or sports medicine and athletics. For us here at Choice, we appreciate that performance can mean very different things for different people. So the idea here is understanding what the patient wants to achieve. We really want to know what is it that we can help you be doing in the run of your day to feel like you're living the life you want to live. It can be getting through your day without pain. It can be, as Aaron mentioned earlier, playing with grandkids and getting outdoors and being active and doing the things you love. So we really want to get an understanding of what performance means to you. And this is something that I try to talk about with any massage therapist with whom I speak. And that's, what's your mindset as a massage therapist? Are you thinking you're going to get in there and just fix someone? Or are you open to being more of a facilitator and just creating space within someone's muscles so that their body can naturally do the things it's not trying to do, and that's bring all the nutrients and oxygen and good stuff in there for them to feel good? Okay, so sometimes just that shift in approach can really make a big difference for people.
Cool. That's neat, Ryan. Okay, so you have some secrets about massage therapy?
Well, it's not necessarily secrets, but some misconceptions sometimes, and ideas that people have in their heads from previous experiences at times, or what they see in the movies.
Yeah.
I tend to cringe at times with what I see on TV and in movies sometimes.
I think probably my profession's the worst for that. Okay. So let's see, what's secret one?
Yeah, the big one, and I've kind of alluded to this already, the massage therapy treatment does not have to hurt in order to be effective.
Okay, yeah, that's true.
Now,
that's true.
Various, shades, it's not black and white. Some people prefer a firmer hand getting in there, and their perception is that, we're not doing positive work or creating positive changes unless, I feel it. But sometimes we need a subtle shift. Sometimes a person has been in pain for so long that they've actually become sensitized. And the threshold for me pushing in there and having their nervous system kind of think, uh-oh, this is an attack. It wants to protect, and it kind of puts on the emergency brake, so to speak. Well, if I'm doing that and I keep going and that's their body's response, really I'm picking a fight with their nervous system, which frankly is a fight I'm going to lose and they're going to pay for. They're going to end up hurting for days afterwards, which isn't necessarily what we're shooting for, especially in those cases where they're already living in pain that's persistent. Okay. So a subtle shift in our approach can really make a big difference for people. Okay. I've often had people say, well, I feel very different getting up, but it's weird because it didn't feel like you did a whole lot to me. And that's where that facilitating concept comes into play. We don't have to hammer on you in order for you to feel very different.
No, that's cool. And secret number 2?
Yeah.
Oh, yes, you don't have to completely undress.
No. So again, all the experience, having been fortunate to work on, athletes at different events of different levels, some just community-based events and some more serious competitive events. You're working on people out in the open on the sidelines where people are still clothed. And so you become familiar with how to provide an effective treatment through clothing, around clothing. And that's something we can very easily do in the context of the clinic. So you don't have to completely undress in order to receive a massage therapy treatment. Something that's it was hammered into my head in school is the level of trust being afforded to us without us having really had a chance to earn it, so to speak, in that people come oftentimes being willing to disrobe, lay in a vulnerable position and let us put our hands on them. And so that can also be a barrier to people feeling comfortable to come in for treatment. So something that your massage therapist can do in any situation is modify their treatment. It's something every massage therapist has had training in, and it is an option.
That's good to know. Good for many out there considering massage, but sometimes they feel like that might be a barrier for many reasons. So Absolutely. That's a great point to bring up. I think this is your third secret.
Yes.
Yeah.
So
Massage therapy, an incredible effective way to help people in pain gently reacquaint themselves with their bodies. Okay.
So I mentioned people get sensitized to their pain. A lot of times people want to be active. They want to get out there and do the things they enjoyed previously again, but they're not sure how to get there. And so they're thinking that they're the version of themselves that's 15, 20 years younger, but the hardware they're working with isn't quite as youthful. So the idea here is by gently and knowledgeably challenging people's tissues with movement and the massage techniques, you can actually kind of help them reacquaint themselves like, okay, that actually doesn't hurt when you press there in that way with a firmer hand contact with more surface area contact on the body, as opposed to a deep, quickly penetrating pressure. You can really help people get more comfortable within their own bodies again. And this comes down to the confidence that's necessary to pursue the lifestyle they desire.
Okay. Yeah, that's kind of a bit higher level, but I think what you're basically saying is you're, as a massage therapist, helping people to connect with their body and regain confidence in their abilities, like whether that's just getting out of bed or walking the dog or like running a marathon.
Absolutely. The idea is to help them figure out at what level they're currently operating and help them figure out what level of ask for themselves is appropriate with where they are. Not that they're stuck there forever, but in a lot of cases, the reason why people haven't really progressed is because they're still trying to impose that higher level of activity they used to be able to perform in a body that doesn't necessarily have everything it needs to be able to do that still.
Right. Okay.
So in the short order, we kind of match ask with ability, and then we can progress appropriately from there. And that's where we really start to integrate with physiotherapy, the kinesiology, and the personal training services that we offer as well. We're kind of making the body more pliable so that then they can go and get that additional expertise and guidance when it comes to moving in ways that they would like to be able to.
Right. This is the best part, you guys. The live demo. And this is why I keep volunteering to be the co-host of these webinars, because I get to be the patient. I'm just going to stop my video. And Ryan is going to work on me.
Yeah, so this is going to be a clothed technique. And it's actually something called fascial stretch therapy, which is something I've been fortunate enough to go and receive training in Arizona, Toronto. And I've been doing this for about 8 years now. And it's a very gentle means of stretching. So when people think of stretching, oftentimes they're thinking aggressive lengthening of the tissues, which this is not what that is. This is more of a take up the slack and gently oscillate with the tissue and the joints.
Sounds good.
So if I can get you to just slowly kind of face the camera for me, Erin, and we're just going to do just a very quick.
You're going to pick on me.
We're going to pick on you a little bit. I know we're going to be doing this side of you. Yeah. What I'd like to get you to do is maybe sit up nice and tall, like you're tethered to the ceiling for me.
Okay.
And we're going to bring that left ear towards the shoulder.
Okay.
Okay. And is that about where you start to feel a stretch?
Yeah.
Okay. So we'll let you look at this. Okay. Then bring your head back to middle position here. And I'm just going to get you to reach over your head for me. Okay. And are you feeling any pull through the front of the shoulder?
I'm feeling it through here.
Through there? Okay. Yeah. Perfect. Okay. So now what I'm going to get you to do is go face down for me on the table, please.
Yes. Okay.
Okay. And arm down at your side for me. Perfect. Just going to move your hair out of the way. So I'm going to come in here and cradle under her shoulder. Now I'm making her feel like I've got a really good grip on her and I'm supporting her. So what I'm doing is I'm kind of squeezing the shoulder and I'm bringing it out to the side. And I can feel that pulling as I pull down and back, I can feel that pulling up through the neck.
Mm-hmm.
Okay. Now, normally in the context of the treatment, we would do a lot more revolutions here. And I'm pulling so that she kind of feels a pull into the chest along the collarbone, into the front of the neck as well. And what I'll do here as well, we're going to get the bicep. We're going to bring her into a bit of a bicep stretch because the bicep goes up into the front of the shoulder. And obviously we would do the other side, but for the purposes of the demo here, I'm going to let you slowly make your way up here, Erin.
Okay.
And then when you're ready, we'll get you in front of the camera and we'll get you to kind of just check left ear to left shoulder.
Okay, so sitting nice and tall.
Nice and tall, tethered to the ceiling again.
Wow, huge difference. I mean, just in what I'm feeling.
Yeah,
and range too.
I can see previously there was a bit of distension under the skin. You could see a patterning or a pull through the front of the neck into the top of the shoulder.
Yeah.
And it's less. So it doesn't take a whole lot to make a bit of a difference.
And like nothing here now. Nothing. A little here.
Okay.
Funny enough.
Yeah, well, yeah, and you'll often hear the analogy of layers of an onion.
Yeah.
And as we kind of make a difference in one area, all of a sudden something will pop its head up. It's almost like the game of whack-a-mole.
Yeah,
right? So,
true enough.
Okay.
With an end in sight.
Absolutely.
During a longer treatment. Yeah.
Definitely.
Okay, that's awesome, Ryan. I am actually gonna share my screen again, everyone, and get back to the actual PowerPoint presentation. There we go. So live demo, and yeah, so obviously that just worked for me, but we know for a very certain fact that massage therapy is highly beneficial, and we have some testimonials from our dear patients that we thought we'd share. So Ryan Young is at the leading edge of the massage therapy profession. I would have to agree. His passion shines through as he slowly works outside of the box to physically connect you with your anatomy in harmony, maximizing functionality and minimizing pain and discomfort. Professionalism at its finest. If you have given up, if it seems no one is listening and you are tired of disappointment, please give yourself one more chance. Make an appointment. That's amazing. What a wonderful testimonial.
And the person who wrote it is
JF.
has been a pleasure to work with, and that's the biggest I guess level of fulfillment.
Yeah,
is when you're able to kind of really collaborate, not just with our professional colleagues, but with the patient as well.
Totally. Yeah. No, it's definitely we're definitely lucky in that regard in our line of work. I've been seen by Ryan Young for several years and can attest to the fact that he is not, quote, just like all the others. Oh dear, when it comes to massage. He does an exemplary job at healing. I would not go to anyone else. That's from BB. So yeah, it's true. Like there's, Ryan's a great massage therapist, and like in any profession, like every profession out there, lawyers, I don't know, teachers, there's good and bad. But I'm really pleased with the team we have at Choice right now and always. We have one testimonial here that's actually just talking specifically about the team in general and specifically the massage department. So I grabbed that one off our Google reviews. I have been seen by the team at Choice Health Center, including massage therapy, chiropractic, physio, and naturopathic medicine. So that multidisciplinary integrated approach, I guess. It is a great one-stop shop. In particular, I wanted to share that I have seen 3 different massage therapists at this clinic, and all would be among the best massage sessions I have ever had, and they all work together to take care of my needs. That's true. Like, sometimes within a department at Choice will refer, like, say to you for specifically a technique you do, like FST.
Absolutely.
And that just what goes around comes around. So coming to Choice has made a huge difference in my health by GJ. So that's great to read as well.
Yeah, no, I'm having fantastic conversations with the rest of the massage therapists at both clinics, sharing ideas and kind of, discussing cases.
Yeah, for sure.
Yeah.
So this picture of a waterfall is basically kind of depicting that we really want that for our patients. We want everything. We want what we want for you is to know that we're here for you. So if you aren't certain what you need, whether it's massage or chiropractic or physio or some combination of these things, that's okay. The difference or the choice difference is that we do know and we won't lead you astray. So we want your results to come in as downstream a way as possible, which is depicted by that waterfall. So it should be easy for you, and that's what we're here to try and do. So there's my little gift picture. So my gift to those participants in today's webinar is for you and anyone that you refer to massage therapy at Choice, you will receive a 1-hour massage for the price of a 30-minute massage. So that is actually a price difference of $40. So you're getting an hour massage for the price of a half-hour massage. And that again is for you watching here today and anyone that you refer to Choice for a massage. The only kicker is that the referral has to be made by the end of June. So this offer expires the last day of June 2021. So anyone that you know that has been suffering, who is looking to improve their pain or their performance, so maybe they're not suffering, but they have some functional goals that they want to obtain, we would appreciate their referrals, and we will give you that gift of that discount. So in closing, I always like to remind everyone that when it comes to your healthcare, you have to remember that you always have choices. So that's what we're here to do. We're here to remind you of those choices, educate you on those choices, and work with you to reach the goals that you're looking to reach. So thank you so much for joining us today. We hope that it's been really informative for you. And I'm going to stop sharing the screen here. And I do want to encourage anybody who's looking to book that you can give us a call, you can book online, and you can also email us at either one of our email addresses. So thank you so much, everyone. And let's see if we have any questions, Ryan.
Fantastic.
Awesome. So we'll open this up for questions. I'll check the chat here. I don't see any from the panelists at all, or that's us for the panelists. I don't see anything from the participants. I also have the Q&A bubble there, but no one had any questions there either. So I'll give you a few minutes in case you have something that has come to mind just now. And if not, you know where to find us.
Absolutely.
All right, guys. Well, we won't take up too much of your time if there's no questions tonight. Feel free to check out the rest of our webinars. As I said, one on chiropractic, one on laser therapy, and now this one on massage therapy. And again, we're looking forward to seeing you for your free giveaway, and anyone that you are, any loved ones or friends, family that you're thinking could benefit from our services. Take care and have a great night.
Bye, everyone.
Bye.